My name is Jack McCarthy. I'm President and CEO of AppleTree Institute for Education Innovation, and I'll be facilitating today's interesting discussion. We'll be learning about the novel partnership among AppleTree, the Early Childhood Innovation Network, otherwise known as ECIN, and the Medstar Georgetown Center for Wellness in School Environments, otherwise known as WISE, that has come together to pilot a successful early childhood mental health consultation model in AppleTree classrooms. I want to underscore how much we appreciate the close partnership that we've developed with Dr. Matt Beal from ECIN and Dr. Aaron Rakow from WISE during this time. Today, we hope to illuminate our findings through a discussion with the consultants and various stakeholders with whom they consult. AppleTree's mission is to close achievement gaps early so children enter kindergarten ready to thrive. Evidence in a research to practice approach to early childhood education is integral to our work. And given the growing mental health challenges in the District of Columbia, we recognize the need to build educator capacity to support each student and family we serve through consultation on trauma-informed instructional practices, but with an added focus on educator well-being. This partnership began with ECIN and WISE in the 2016-2017 school year in 2 preschools that AppleTree operates with LEA school partners. In school year 2017-2018, we were able to launch this program at 5 AppleTree campuses. Currently, with generous expansion funding, we have 2 consultants, 1 with WISE and 1 through AppleTree, currently serving 8 campuses through this current school year. I'd like to thank the current funders who are underwriting this work. The Marriott Foundation has underwritten most of this work, and the Vendor Foundation has supported this discussion today to bring this information to you. So now I'd like to introduce the early childhood mental health consultation panelists. We'll hear directly from those who are involved with the program, including our consultants, our school staff, and those who are involved with research on the model. I want you to feel free to chat any questions as our panelists are speaking, and we'll make sure to answer them in the end. So first, I'd like to call on Dr. Brenda Terry Leonard from WISE, and then I'll call on Aisha Bryant from AppleTree to introduce themselves and to provide us with an overview of the consultation model. Dr. Brenda Terry Leonard, please.
Thank you, Jack. Good morning. So I am Brenda Terry Leonard, a clinical psychologist with Medstar Georgetown University Hospital, the Center for the Wellbeing in School Environment, the WISE Center. And I provide early childhood mental health consultation to 4 AppleTree campuses, including Douglas Knoll, Southwest, Lincoln Park, and Oklahoma Avenue. So now I want to tell you about the model. So early childhood mental health consultation is a clinical intervention that's utilized in early childhood settings where a clinician with a background in early childhood development collaborates with educators, including teachers, principals, social workers, and instructional coaches. The focus is on classroom climate, student social emotional learning, challenging classroom behavior, and then the overall program environment. Collaboration and problem solving are hallmarks of the intervention, with a mutual exchange of ideas and perspectives when planning interventions and understanding classroom dynamics. It is not an instructive process where the consultant tells the teacher what to do in the classroom. Rather, the teacher and the consultant mutually develop a plan for consultation. So early childhood mental health consultation is a capacity building and problem solving process. Early childhood mental health consultation is delivered at the programmatic, the classroom, and the individual student level. Programmatically, the consultant meets with the principal at the beginning of the school year and throughout the school year to discuss the needs of the individual campus. Consultation is then tailored to the particular campus based upon the issues that are identified. So professional development may be provided in one school, while parent seminars may be provided at another campus, or both professional development and parent seminars may be provided at a different school. Weekly check-in and check-out meetings between the consultant and the principal are held throughout the year, during which the consultant reviews the classroom observations and the summaries of the consultation meetings that are held with the individual teaching teams. The principal also provides updates on the campus dynamic and culture and may be reflective on his or her role as the leader of the community. So depending on the preference of the principal, the school-based social worker, and the instructional coach may be a part of the check-in and check-out meetings. Classroom consultation focuses on the overall classroom climate and the interactional patterns within the classroom. So those interactions between students, the interactions between the teachers and students, and then the interactions within the teaching team. Classroom climate is formally assessed using two measures, the preschool mental health climate scale and the preschool observation of socio-emotional teaching. Based upon the quantitative data, input from the principals and the school-based social workers, classrooms are identified for consultation, and then subsequently weekly observations take place, followed by consultation with a team of teachers in classrooms where consultation is taking place. Case-based consultation is provided for students that are experiencing challenging behaviors in the classroom. Referrals typically are made by the social worker and the principal. And this level of consultation requires verbal consent because observations are made of individual students. So during case-based consultation, targeted classroom interventions are collaboratively developed by the consultant in conjunction with the teaching team to address the challenging behaviors that are taking place in the classroom. This level of consultation does not include direct service. Rather, teachers are supported in managing the classroom behavior of a particular student.
Good morning. I'm Aisha Bryant. I'm a licensed graduate professional counselor in DC, and I'm the other early childhood mental health consultant coming through AppleTree. I provide supports at 4 campuses: Achievement Prep, Rocket Ship Rise, Parklands, and Perry Street Prep. Despite changes with beginning virtual learning, consultation does continue. We have adapted the services and will continue to adapt the services as the settings change. And despite this transition, we do continue to support teacher wellness and capacity building, along with family and student wellness. So, sharing our adaptations for this current school year, all classroom observations will take place in the virtual classroom through Google Meets. Our cameras are off, we're muted, and teachers do notify parents that an observer is joining. In the event that we cannot join a live class, there's the option to also watch the recordings of the lesson. All information that we gather from that will be discussed with classroom teams afterwards, which goes into the consultation meetings. There are those meetings that will continue as they would have in person, except they will just happen virtually through Zoom or Google Meets. We meet weekly, and we try to have a primary day per campus like we would have in person, but there is some flexibility for scheduling the meetings with educators. Also, we still provide PDs or professional development, and that is related to various mental health topics on wellness or for student behavior as well. We continue to collaborate with social workers and instructional coaches, and we continue to have our weekly meetings with principals to discuss any needs or any routine updates.
Thanks very much. As the model serves 3 different aspects of the schools, we'd like you to hear directly from some of those who have direct experience with the model in our preschools. First, we have Ms. Siobhan Smith, who is the principal of AppleTree's Southwest campus. And the question I have for Siobhan is, how has early childhood mental health consultation been a benefit to your school and to your teachers?
Hi, thank you for that, Jack. Hi, my name is Siobhan Smith. I am the principal at our Southwest campus. I do apologize. The power went out in my home, so I had to call in. But ECMHC has provided quality support for my staff and my campus through the partnership with Dr. Terry Leonard, who is the consultant at my campus. She's provided intentional social emotional coaching for teachers to implement in their classrooms. Not only does she provide that support on a classroom level, but also on a personal level. My staff has had the opportunity to talk with Dr. Terry Leonard about their concerns, and we all know that as the adult social emotional mental health is very important, and it has an effect on how staff perform at work. So if they're in a great mental place, then they are able to better support the students. And with Dr. Terry Leonard's support and help, my staff is better able and better prepared to support my students. We also have had self-care sessions led by Dr. Terry Leonard. She's given the staff opportunity to share concerns and also to receive advice on how to cope with these unprecedented times. And it's really allowed my staff to open up and to feel safe and really trust the support and the answers and the advice that Dr. Terry Leonard gives. For me, meeting with Dr. Terry Leonard weekly is a great time for us to collaborate on what we observe. And it's really helpful when we see the same concerns. That validates me as a principal and also validates her as a consultant. And we're able to talk through the next steps and how to best support the staff members so that in turn they can support their teachers. This partnership has been very valuable to me as a leader, and I really do appreciate everything that Georgetown has done and Dr. Terry Leonard.
Thanks so much, Siobhan. I'd like to introduce now Ms. Dana Boston. Dana is a preschool teacher at AppleTree's Parklands campus in Ward 8. Dana?
Thank you, Jack. I'm Ms. Dana Boston, and I work at Parklands in Southeast, and our mental consultant is Ms. Aisha Bryant.
Dana, I'd like to ask, how has the early childhood mental health consultation supported your work as an educator?
Okay, so my consultant at Parklands has helped impact my work by providing me with strategies to use to help challenging situations with the children in the classroom, whether it is socially or emotionally. She has also helped support with positive and social emotional wellness in the classroom by helping give strategies and providing different ways where I could de-escalate situations beforehand so I could eliminate these type of behaviors or meltdowns that will take away from our academics. So it's been a tremendous help for us.
Great, thanks. And just a follow-up question, how has the early childhood mental health consultation helped your own personal development and well-being?
It has helped me personally because it's been able to give me strategies to overcome feelings or emotions that I may feel. It has also helped me identify things that are within my control versus things that are outside of my control. And by doing this, it has built my confidence as an educator. I'm able to promote the social emotional wellness in the classroom through a positive climate and strengthen my management and also build relationship with other adults, which has also been tremendous for us because it starts there with building the relationships among the adults before we could actually successfully give the academics to the students.
Thanks very much. I really appreciate that. I'd like to turn now to Ms. Ali Perez, who serves as our social worker at AppleTree's Oklahoma Avenue campus in the Kingman Park neighborhood of Ward 7. Morning, Ali. I'd like to ask you the first question. How has the early childhood mental health consultation augmented school-based social work at your campus?
Of course. So as Jack said, I'm Ali Perez and I'm the school social worker at our Oklahoma Avenue campus. And looking back now at our several years of experience with early childhood mental health consultation at our campus, I can say without a doubt that the services have supported really positive outcomes with some of our most challenging classrooms. Me by myself would not really have made much of an impact. As the school-based social worker, I'm responsible for working with teachers and parents to develop plans of support for individual students. And then I provide those direct services across all of our classrooms, such as push and support, social skills groups, and counseling. And the classrooms that have been identified to receive consultation services from our consultant, Dr. Terry Leonard, they have been very demanding environments for teachers, with at least one student requiring a significant amount of teacher and social worker support, and often more than one student. So, and many of these students are experiencing poverty, trauma, grief and loss, and now the pandemic, like a range of difficult experiences. So the classroom environments I'm speaking of have been extremely stressful for both teachers and students at the beginning of consultation. So Dr. Terry Leonard has been able to really augment my services by providing that weekly dedicated time to our most challenging classrooms, observing them in person and now virtually, giving the teachers time to reflect with her in a really supportive space, and really sharing her expertise and observations to help the teachers develop their capacity. And this is really an essential complement I've found to my direct services and my work with teachers and parents. So during and after the consultation process, I've seen really clear improvements in each of these classrooms in areas of teacher wellness, like that allows teachers to better support their students when teachers are well, but also trauma-informed teaching practices, including those stronger relationships between co-teachers and between the teachers and students themselves. We know how important those relationships are. And at the same time, related to that, I've seen corresponding decreases in the overall stress level of those classroom environments, definitely by the end of consultation. So it's been really helpful.
So thanks very much. Tell us about the ways in which school-based social work collaborates with the early childhood mental health consultant.
Definitely. So Dr. Terry Leonard and I speak often. I have frequently drawn on her expertise to make sure that our plans for supporting individual students are as effective as possible. We often collaborate on professional development offerings for school staff on topics like educator self-care and how to support students and families who are grieving, which is especially important this year. And this year in particular, we've collaborated on developing new programs so that staff are receiving the support that they need for their own mental and emotional health so that they're able to support the mental health of students and families.
Thanks so much. I want to thank all of our panelists this morning for sharing their experiences with us. I'd like to call on Karen Hartz-Mandel, who's a clinical psychologist with Medstar Georgetown, who'll share some of the current outcomes from this program with all of us. Karen?
Thanks, Jack. Good morning. My name is Karen Hartz-Mandel. I am a clinical psychologist at Medstar Georgetown, and I work with the Early Childhood Innovation Network on the evaluation of early childhood mental health consultation at AppleTree. I'm so pleased to be here today to highlight a few positive outcomes we have observed for students, teachers, and classrooms from our evaluation over the past 4 years. From previous research on social emotional interventions in early childhood, we know that when the social emotional environment in children's early classroom environments is strong, it promotes children's positive behavior and academic skills. These skills are critical not only in preschool, but are also the foundation for children's readiness when they enter elementary school. Therefore, in our evaluation, we examined whether early childhood mental health consultation positively impacted children's behavior and academic skills, as well as the quality of the classroom environment. We found that students whose schools participated in consultation were reported by their teachers to display more positive behavior in the classroom compared to students whose school did not receive consultation. This included students having better control of their behavior and more positive interactions with their peers. For students in consultation schools, school staff also observed fewer disruptive behaviors in the classroom, such as students having problems with attention and difficulties calming down when frustrated or sad. Importantly, students in consultation schools were also more proficient in early academic skills, including early math and language and literacy skills. Additionally, teachers reported significant improvements in the emotional climate in their classroom after participating in consultation, and teachers said that they were highly satisfied with this program. We're really encouraged by these findings because they indicate that teachers feel supported by this program to address classroom challenges, and this support is key for promoting teacher well-being. Observations of classrooms before and after consultation also revealed improvements in the classroom environment. Classrooms that participated in consultation showed improvements in mental health climate. A positive mental health climate in the classroom includes positive interactions between staff and students, smooth activity transitions, clear and consistent rules, and promotion of skills for managing feelings and solving problems. We also observed improvements in effective teaching practices to support children's social emotional development. For example, teachers' use of praise and reinforcement to encourage positive behavior and proactive responses to reduce misbehaviors in the classroom. These improvements in the classroom environment are really exciting because these are the components of the kind of strong, positive classroom environment that supports children in building the social, emotional, and academic school readiness skills that will set them on a trajectory for success in elementary school.
All right, thanks. Thanks very much, Karen. I will ask Megan Berkowitz if we have any questions in the chat that that we would like to discuss.
We don't have any current questions, but if people do have any lingering questions, please just put them in the chat, or you can even pop off mute and ask them directly.
Do we want to pause for a minute there just to see, give anyone an opportunity to pose any questions in the chat?
Yeah, sounds good.
Okay, great.
Jack, this is Mika. I'm happy to just pop off mute and ask my question if that's more efficient.
Perfect.
Great. First of all, thank you all for doing this. And on behalf of the Marriott Foundation, we're really pleased to be able to support this work. Clearly, the combination of student support and educator support here is essential and has been vital for school success. And I guess what I'm wondering is sort of given limited resources, how do we think about prioritizing student wellness versus teacher wellness in this context? And if we had to sort of, split pennies, how would those of you engaged in the work on a daily basis think about the prioritization? Obviously, we know we need both, but just curious how you would think about allocating resources across those two categories.
That's a great question. I guess the question would also be in normal times or also in these times too. That might be another way to think about it. Because,
yeah, and I'd love to hear both, actually. It'd be great.
Yeah. Who would like to take that on?
I would love to take that on.
Great, Allie,
I'm
thanks.
sure other people will too, but a lot of my work, obviously I said I work directly with students, but a lot of my work is with teachers and parents and caregivers in particular. And what I've seen from my experience and from research is that children will respond to the health of the adults around them. So I would not say it's what we would prioritize one over the other, but it is an important point that student wellness is directly going to be related to educator wellness, if that makes sense. So we need, especially right now when educators, just like the parents of our students, are much more stressed because educators have their own children, they're dealing with their own grief and loss, getting sick, losing family members, especially now if we're comparing the before times and the now times. it is especially important, I think, to not prioritize more, but prioritize educator wellness in particular.
Thanks, Allie. And well, before others jump in here, one other note I'd love to add to that, which is what has proven to be most effective in supporting educators. I know some of it is on-site in schools, but as we think about scaling this model, what's the best way? Again, let's talk about non-COVID times. What's really the best way to reach educators and provide them services that don't add stress and logistics to their lives, already busy?
Well, I'm sure the consultants can. Oh, sorry, go ahead.
Who'd like to take that one?
This is Siobhan at Southwest. When we're not virtual, being in the building, a lot of the times Dr. Terry Leonard met with my staff. She would meet with them either during their lunch break or immediately after school. And it's on a day that I'm not having a meeting, so it allows them just that time to focus during that time. And I think when they have those meetings, it really allows the teachers the opportunity to talk about their concerns and it's not like an extra thing that they have to do. It's during the day, it's during their work day. It gives them advice on how to support their students and to care for themselves. So I think that is one of the most valuable parts of this. And then going back to your first question, an example of that is one of the indicators that is observed when Dr. Terry Leonard goes in and does her observation is teacher affect. And when teachers have very low affect, it in turn goes out to the students. They're not as excited as they should be. And part of what Dr. Terry Leonard does is talk with teachers about how they can build their affect and make it more enjoyable and positive. And by doing that, it does reflect on the students. So I too wouldn't say one is more important than the other, but to really have impact across the board, because we ultimately want to support the students. They're very important. This is why we do our work. But having that teacher in the right mental space will allow students to receive that teacher's undivided attention and support.
Thanks very much.
Thanks,
okay Mika, for stimulating. Oh, go ahead, Aisha.
Allie and Siobhan put it very beautifully. The only thing that came to my mind of adding, so that doesn't feel like an extra weight for teachers, is that we do spend a lot of time building rapport and relationships. And outside of the observation data, it's not just us like saying, well, these are the things to work on, let's focus on this. We open up the space of like, is there anything that's on your mind, so that it has more value compared to it just being an extra time, an extra task. And definitely, since we do care and focus on their own wellness, people do use that space a lot to just like vent and share things that they might not have been comfortable sharing with leadership. And it's also in a protected space of like, if this is something you would like for me to pass on, I can, and I can, keep your name out of it. But if you would just like to keep it here, that's also respected too. So I think that a lot of teachers find value in it, but it's just how consultants present that to make it worthwhile for them.
I would also like to add that there's an immediacy to the support that teachers receive, because in class-based, school-based consultation, the consultant is actually in the classroom making live observations, and so that gives the consultant and the teacher the opportunity to have real-time support and coaching. So the interactions are taking place, the consultant is making the observation, and the consultant can provide immediate intervention. So when you talk about kind of like not placing an additional burden on teachers, so we don't have to have, another meeting, that intervention can be discussed at that very moment. So teachers aren't feeling like they need to wait to get feedback, the feedback can be given in real time. So I think that's another value of the intervention, is that it's on site, it's in the classroom, teachers can get immediate feedback, and the intervention can be immediately applied in real time.
Thanks again, Mika, for getting the conversation going. Really, really appreciated that. It looks like we do have some questions now in the chat. And Megan, can I call on you to start to go through them?
Yeah. Hi, everyone. My name is Megan Berkowitz. I'm the Positive Behavior Support Manager for AppleTree's. So I lead the implementation of this model on the school side. And Ms. Klingenstein did have a question. She asked, how many total schools are we working with? Right now, we are in 8 of our campuses. We have 11 campuses total. So we serve most of them, but not all of them. Mr. McKee has asked, how would this model differ if it were working in classrooms with older children?
Who would like to answer that?
Well, I envision that it would work in a similar fashion. Consultants would be in the classroom making observations. I also feel like with older kids, there may be on-site direct services, and the consultant in turn would work collaboratively with the clinician who's providing that direct service. So I think it would be collaboration between the school-based teachers, the clinician who's providing on-site direct service for the individual, and then the family would be looped in, I think, also as well. So I think it would work in a very similar fashion. I think that consultation would just include the person who might be providing direct service, and then family, so that there would be this whole, community intervention with older children.
I can also add to that, and it actually leads into our next question, which Mr. Brunner has asked, could you please talk about the most important measures you use to capture your outcomes and the pros and cons of each measure? And so I will say the measures are very targeted to the early childhood population. So the evaluation and research on outcomes for older children, those measures would probably look different. But I will pass Mr. Brunner's question on to Dr. Hart-Mandel.
Thanks, Megan. So yes, in terms of the measures that we use, as Megan mentioned, these measures are developed for an early learning classroom environment. So a couple of the key measures that we used, one was the preschool mental health climate scale, which Dr. Terry Leonard mentioned earlier. This measure was developed by one of the leaders in the field of early childhood mental health consultation, Walter Gilliam. And so that's an established measure, and that's one of the benefits of that's a measure that's been used elsewhere in the field. And then the preschool observation of social emotional teaching is a measure that myself and Dr. Mathis, who leads the evaluation team as well, developed. And so that's a newer measure, but it's one that we developed to be able to specifically capture some of the practices that consultants would be supporting teachers around, so that it would be really closely tied to the areas where we would expect to see change based on consultation. And then in terms of student behavior, the measures that we use are measures that AppleTree uses as part of typical practice. So the preschool behavior rating scale is the measure that captures student behavior, and the Every Child Ready direct assessments of academic learning. And so the benefits of those are that AppleTree has put a lot of work into developing those measures, and we know that the outcomes that we're seeing are really closely linked to, we're seeing that on the measures that are used as part of standard practice within AppleTree.
Dr. Hart-Mandel, did you also want to share about the teacher surveys and the satisfaction surveys?
And the satisfaction surveys, sure, I can share about those as well. So the satisfaction surveys are ones that that our team has developed to get perspective from teachers on how satisfied they were with the service. And And those ones are ones that our whole team, the ECIN team, AppleTree, and WISE have worked on together. And so we have modified those across time to make sure that we're, gathering the feedback that we really want to hear from teachers, principals, and social workers as well. And so I think, one of the pros of that is that it's really been a collaborative effort amongst our team to develop that survey, to make sure that we're really getting the most effective feedback, and then that we can, make adaptations based on that feedback that we get.
Yes, I will definitely add that I think one of the benefits to this partnership has been able to really craft to what AppleTree needs as its own institution, but also be able to look to see how it could be scaled outside of AppleTree specifically. And it's been a great luxury to have that flexibility for Marriott to be able to make those adaptations both on the implementation side as well as the research side. We do have one last question that I will pose for the consultants as well as our clinician, which is, what mental health tips can you provide for some of us who have children at home on virtual learning, but their school does not have consultation? The age-old question.
Well, the lovely thing is that we have created a YouTube series about this, and I could actually put the link in the chat to it. But we have a connected family series that's giving different tips to work at home, particularly with children. Me personally, the biggest one is trying to set routines. But there are also some videos there that are for adults and educators as well, talking about different techniques for dealing with stress, breathing, taking those breaks when you need to, because I'm also a parent dealing with distance learning at the same time. But for myself, the number one thing that I would say is definitely making a routine, but being realistic with it. So not overloading yourself and not overloading your child, and just giving yourself some grace during this time.
Great. Thanks very much. Oh, go ahead.
I can add to that because Aisha, you said it. You really said it. But I'll also add, on the one hand, I'm sorry your school's teachers don't have access to consultation because it is so great. But I hope that there's a social worker or a counselor or some kind of clinician like that you could access for support. And the videos that Aisha mentioned are really wonderful. And I found a big part of my job this year has just been letting parents, caregivers know about the resources that are out there for parents just to look over. A lot of places, the Clay Center for Mental Health, Children's Hospital, they posted a lot of great, just very quick resources for caregivers with everything from how to talk to your kid about coronavirus anxiety to routine setting and things like that. So keeping it simple, and taking care of yourself also.
Yeah, I think one of the most challenging parts of this experience we're all having right now is that we don't know how long this is going to last, and we've had these conversations where you can pace yourself when you know you need to get through the next month or the next two, but I think given all of the the current public health and economic challenges, we just really don't know how long this is going to last. So I think these are really important things to share broadly and to know more about. I don't know if there are any other questions that anyone would like to ask at this point. If not, I'd like to introduce Eric Goulet, who is here from the office of Council Member Vincent Gray, who, as we said, we've been talking with members of the district council over the past year. Ultimately, we think that this work is deserving of public support to sustain it and to broaden it. And the district has been a leader in this work and has made some big investments, but we know we're going through interesting times and things are changing. but Mr. Goulet is here to, I think, offer some words of support for this work. So I'd like to introduce him if he's able to unmute and talk at this point.
Perhaps we can speak a little more and then see where he is.
Okay. All right. Well, anyway, we had a great meeting with Mr. Gray and Mr. Goulet last year before the world changed. And particularly, you know, Councilmember Gray has been such a strong advocate for early childhood education in the district. And when we went through our 2-pager where we showed the cost benefit of this, and I think people may have seen the economics on this, but basically for about $390 per child per year, this service could be provided. So it's really cost effective. And I remember Mr. Gray just saying, "This is cheap. This is something we should be doing." So he offered his support and encouragement, and it was very heartening for us here. So I guess I can
Hi,
just. Oh,
Jack, I'm on. Thank you so much. I've been jumping back and forth, trying to be in 2 places at once here, but this has been an incredible meeting. I really appreciate that you invited us to it. And I just want to reiterate what you said about Councilmember Gray's support for this exciting initiative. I mean, since he's got back, school-based behavioral health issues have been one of the things that he's felt, is the most important way to try to keep kids connected to school, interested in school. He wanted to get the task force that we've done now, and we've added over $4 million the last 2 years to school-based behavioral health. I mean, this initiative is something that he would really like to do, even with the fiscal difficulties the city has right now. I mean, this is a cost-effective way to really help kids out, as they emerge from this pandemic with all the mental and emotional strain that it's caused on kids, to really do something that's cost-effective and that drives outcomes in a positive direction when the kids come back in person. So I apologize I had to come in and out of the meeting, but I really appreciate you giving me a chance to just reiterate the council members' support for something that's really exciting that hopefully will get done in the next budget cycle. We've got a budget cycle coming up just about 6 months from now. We'll be looking at the FY22 budget, and this is something that's at the top of his list for things to get done as we look at the next budget cycle. So if anybody's got questions, I'm glad to take a question or two real quick, but just want to thank everybody for the great presentation today and allowing me to jump in here at the end and give some quick remarks. So thank you very much.
Thank you, Eric. We really appreciate, and we all are extraordinarily flexible, since you can see we're all calling from all sorts of strange places today. So we certainly understand jumping in and jumping out. We really want to thank you very much for participating with us today. Does anyone have a question for Eric before we close?
Eric, this is Miko Wick from the Marriott Family Foundation. It's nice to meet you, and I appreciate you being here. I'm curious, sort of, your sense of optimism around the budget proposal, what kind of support you're feeling, and what's needed from folks like us, and funders and/or practitioners, to help push this along. Because clearly, I think the needs, as we all know, are going to be even more extraordinary coming out of the pandemic, and we need to be prepared for that sooner rather than later.
Yeah, thank you. I mean, it is going to be a tough fiscal year, no doubt. I mean, the city's revenue estimate just came back lower on an ongoing basis. We had some money for the year we just closed out, fiscal year 19. But going forward, it is going to be a challenge. We've got a tight budget this year, a revenue gap we've got to close. I'm not sure whether the mayor is going to try to close it this year, or they're just going to do it for the upcoming budgets and then use fund balance for this year. But I mean, this is one of the things that Vince really sees as a top priority. The last budget, we saw a huge revenue reduction too, and we were able to put funding into priorities of his, like school-based mental health services. So it's something that he and I have talked about, and something that he wants to focus on. Our committee is pretty vast. With the health committee, we've got the largest budgeted agency in the city with the Department of Healthcare Finance. We have Department of Health, and we have Department of Behavioral Health. So, I mean, within a budget of that size, there's always room to fit, a pilot program like this in. and to try to put investments where we really think they're going to drive outcomes. And this would be one of those cases right now. I've talked to Jack, I've talked to Michael about this, and it really is something that Vince believes heavily in, and really talks about trying to get kids on the right path early. That's why he's been the biggest supporter of birth to 3 and pre-K on the council, and really wants to keep driving that forward. I think what we're also trying to look at with birth to 3 is, right now maintaining our supply of high quality birth to 3 providers, not slipping backwards at all during the pandemic. Certainly I would be dishonest to say that, the loss of revenue with COVID hasn't slowed our progress on birth to 3. It has, of course, but if we can maintain our footing now, keep the subsidized rates, where they are, keep, the city from losing any providers in this area, and then expand, as soon as we emerge from the pandemic again, and just try to, bring everybody back to what's an incredibly important issue, which is childcare, which is behavioral health services for kids. I think we're going to really be poised at that point to really make a good case that this is something that the city needs to invest in as we get out of this COVID situation. But it'll be a tough budget cycle, but I want to say that there's always space in a budget for things that you care about getting done. And this would be something that we really deeply care about and believe in. So we'll fit it in and we'll make it happen.
Thanks so much, Eric. And I want to thank everybody for participating with us today. One of the things I think that's so interesting about AppleTree is how many of these really interesting, innovative pilots we have going on in different facets of the work we do. And that's, I think, one of the unique value propositions of this. And I really love having the opportunity to bring such a diverse group of people together to share out in very personal ways and very data-driven ways the effect of this to try to improve practice and influence policy. So thanks everyone for participating today. I'd like to close with this ask. We all know that we need to provide teachers, families, and children with more and effective mental health support to prepare kids to thrive in schooling. So I'm going to ask that you take a personal interest in this pilot and that you work with us to help continue funding for this until we get public funding to sustain it. Over the past few years, we've seen substantial growth in positive data, and it highlights the difference in cost benefits that an early childhood mental health consultation model can provide to support not just the 3 and 4-year-olds in the district, but those people who educate them. Ultimately, we believe these services are worthy of public support, and given the exigencies of our current pandemic and our current economic challenges, we need to continue this work supported by philanthropy to make the case for its impact. We've enjoyed sharing this information with you today. And we've had the pleasure of meeting with several members of the DC Council, a conversation that we will continue in making the case for public support. If you're interested in learning more, please reach out to us. We're happy to provide you with a personalized briefing and more details on this program's impact. This program will not continue without the support of partners who recognize its value, and the conditions under which we're currently operating makes that even more important, as you've heard today. Thanks very much to everybody for spending time with us today, and we look forward to continuing our conversations with you. Thank you.